Hi, I just want to do my case study on Miss Joyner. And just a little background on her. She is, her age initially is not known. She's African American and she's widowed. Her name is Olivia Joyner. And she comes into a mental health center brought in by the police because she's been wandering around a Greyhound station for about 36 hours and is confused. So upon speaking with her and just her initial confusion and hearing her responses to some of the questions that's asked, she knows her name and she's clear on that. She thinks that she is catching the L. She's looking for the L to go shopping. And she is from Gary, Indiana. Once her identification is looked at, I ask if the police can look at her into her handbag, and her identification reveals that she's 93 and she's from Gary, Indiana. And I currently am in Georgia, Quitman, Georgia. So she's traveled quite some distance, and she is, somewhat confused. So I think for initial diagnosis, one I was thinking was 331.83. And in parentheses G3184, with mild neurocognitive disorder, possible Alzheimer's disease. The reason why I was leaning towards that is just her age, and she's a female. The DSM, does talk about having a history of, it says steadily progressive gradual decline in cognition. I'm only seeing her initially, but that could be a possibility until I speak with someone else and find out if there's anything going on. No evidence of mixed etiology, meaning, there's no other causes. So right now I don't really know that. So that would be one diagnosis. The other one would just be 799.59, R41.9, unspecified mild neurocognitive disorder. Obviously she has something going on with her memory and not knowing where she is, realizing that she took the Greyhound, and she doesn't recognize that she took the Greyhound as opposed to the L, and but she does have some, recollection about things. Her conversation goes back and forth. So those are just two that I'm thinking of initially. Then I speak to her again, bring her in something to eat, offer her a sandwich, and she's talking about food, asks if she knows what year it is, and she said no, she can't keep track of her schedule anymore. Asked if she knows where she is, and she doesn't. She was looking, she said, that she's been coming here most of her life, but everything just looks strange. And so she, and in the first part, she's dressed, in the first time that I speak with her, she's dressed nicely. She doesn't seem like she's unkempt, like she lives out on her own as far as like being homeless or things like that. So she looks like she's well taken care of. She's just confused of what's going on right now. So what diagnosis would I give her after speaking to her again? She's able to talk, to give a name, because I asked her about a contact information. So she's able to give a name, saying that her son Carter would come. Of course, when I ask for the number, she gives 459. Could be a house number, maybe like a street address, as opposed to a phone number. It could be part of a phone number. So she is, still answering those questions, but still somewhat confused. I think I would probably, at this point, the fact that I don't have any history, I think I would lean more towards the 799.59, the unspecified mild neurocognitive disorder, just because I don't have anything right now to link it to anything else. So that's kind of where I would be at. As far as besides contacting family, who else would I want to talk to right now? I would want to consult my supervision, at the facility, and maybe other colleagues, just to get some input. I would love to have a medical examination done on her, but that's not possible at this point. I've gotten verbal permission to call her family members, so I've got to get that phone number. And so the police are working on that currently. But once I have that phone number and I can speak to family, then I can get a verbal permission to take her to the hospital. I can speak with Mrs. Joyner as well, and asking if it's okay for her to go to the hospital, but getting a doctor to look at her to rule out any other medical. And I'm thinking right now, like along the lines of maybe a stroke, some kind of, she doesn't physically look like she's been harmed, so I wouldn't say she was like hit on the head or anything like that. But again, I'm not a medical doctor, so I would want a medical doctor to look at her to rule out anything like that. I've looked inside of her handbag. I don't see any medication. I don't see anything else in there that would alert me to any kind of medical condition that she might have. Again, she looks, healthy from what from speaking to her just on appearance, but that doesn't mean that she is. So I'm not sure as far as anyone else to speak to. I think those would be the ones at this point that would do me the best. Obviously, speaking to her family will be the most important. So I'm able to get in contact with her daughter-in-law, Mrs. Carter Joyner, and she actually tells me that her mother-in-law is actually sharp as a nail. And she takes the Greyhound into the city, and then she goes all over on the L. She handles her own money. She even makes the comment that most of the time she seems to have it put together more than she does. The elderly Mrs. Joyner seems to have things together more than her daughter-in-law. And, I make the comment to her that she, hasn't been injured or anything. She doesn't appear to. She may not have eaten or slept. Her daughter-in-law says she's been missing for 6 days, so that's quite a while to be unaccounted for. Don't know if she's been eating well. That could be some of her confusion. Maybe she has not eaten or slept well, and so those are all things that could be. She's elderly, so there are lots of medical conditions that could cause this, not knowing what's going on. So, but her daughter-in-law hasn't seen this. And so I would, at this point, probably take away the Alzheimer's, the mild NCD, with possible Alzheimer's disease, just because I don't have anything that would lead me more to that. Now, in my mind, I'm thinking more of a medical reason that's causing this disorientation. Not to say that it hasn't been there, because she does live alone. Her family doesn't, they seem to know a little bit what's going on with her, but they obviously let her go off by herself. So maybe they haven't seen, some of the symptoms that would lead to a diagnosis of Alzheimer's disease. But as of right now, I think I would take that off the board after my interaction with the daughter-in-law. So not necessarily a new diagnosis, but I would definitely keep the unspecified mild neurocognitive disorder on the board right now. I might also add the 331.9, G31.9, possible major vascular neurocognitive disorder, just because now I'm thinking along those lines of a medical reason. Does she have a stroke? Did she have some kind of a brain bleed? Has something happened in her brain? And so now I'm thinking along those lines. So I get permission to take her to the doctor and, say that I will let them know. They say they're going to be on their way soon. So I take Mrs. Joyner to the emergency room, because seems like the quickest way to get her taken care of. The doctor tells me that at this point, that looks like she's had some sort of a brain bleed. I don't know if they've done some kind of imaging to find that out or not, but at this point, that's what they're saying that it looks like. So my final diagnosis, I think, would be to say possible major vascular neurocognitive disorder. Also, if they've done a scan and seen a brain bleed, it could be changed to probable vascular neurocognitive disorder, which is 290.40 F01.50, because if they have something that's pointed to that. But I think overall my main diagnosis would be 331.9, G31.9, the possible major vascular neurocognitive disorder. And then some V and Z codes for psychosocial and cultural factors. V60.3, Z60.2, probable problems related to living alone, because she lives alone. And then V40.31, Z91.83, wandering associated with a mental disorder, and I would code that along with the major vascular neurocognitive disorder. So those are my findings for Miss Joyner.